Welcome to this training module on medical error prevention and safety. As a certified nursing assistant, you are the eyes and ears of the healthcare team. Because you spend more direct time with patients than almost any other staff member, your role in preventing errors is absolutely critical. Reducing medical errors isn't about one person being perfect. It's about a comprehensive, system-wide approach. Prevention begins with identifying risks, strengthening our systems, supporting healthcare professionals, and actively engaging our patients. No single strategy eliminates errors entirely. Instead, safety improves when multiple layers of protection work together, a concept often called the Swiss cheese model, where we try to line up our defenses so that no hole allows an error to pass through. Let's start with the most common factor: human error. Healthcare environments are complex and fast-paced. To keep patients safe, we must have strategies in place to reduce cognitive overload, fatigue, and distraction. First, we must limit unnecessary interruptions. This is especially vital during high-stakes moments like medication preparation or clinical procedures. If you see a colleague preparing meds, wait until they are finished before asking a non-urgent question. Second, we must manage fatigue. While we all want to help, it is important to avoid excessively long shifts whenever possible to maintain mental alertness. In high-risk areas like operating rooms, maintaining a quiet, focused environment is a requirement, not a suggestion. We also use cognitive aids, tools that support our memory and decision-making. These include things like checklists, clinical algorithms, and mnemonics. Many of these are now embedded directly into electronic health records. For example, a prompt might pop up to remind you to document a patient's intake or to check a skin site. These standardizations help prevent omission errors, which is simply forgetting to do something that was required. To help prevent cognitive bias, which is our tendency to jump to conclusions, clinicians use the rule of three. This involves pausing to consider at least three possible explanations for a patient's symptoms, reevaluating assumptions before finalizing a decision, and encouraging collaborative discussion. This deliberate pause prevents what we call premature closure, or deciding what is wrong before all the facts are in. Every healthcare organization maintains a formal incident reporting system. This is a vital tool for safety, not a tool for punishment. Staff use these systems to document near misses, where an error almost happened but was caught, as well as adverse events, sentinel events, and generally unsafe conditions. Reporting helps us identify patterns and system weaknesses. Organizations accredited by the Joint Commission are actually required to monitor these events to maintain quality standards. Simply having a structured system strengthens our collective awareness and accountability. Most systems have a dedicated risk management department. Their job is to identify, analyze, and mitigate risks before they reach the patient. They conduct ongoing risk assessments, review those incident reports we just talked about, and perform root cause analyses to figure out exactly why a mistake happened. Let's look at how they manage these risks. Avoidance uses forcing functions, designing a system so a mistake is physically impossible. An example is restricting overrides for high-alert medications like rocuronium. Retention means we accept a certain risk because there is no better alternative, like using two different medication suppliers to ensure we don't run out. Spreading risk means we don't put all our eggs in one basket. For instance, we store backup pumps in different facilities so a single flood or fire doesn't destroy all our equipment. Finally, transfer involves insurance contracts to handle the financial risk of errors. Ongoing education is your best defense. Most facilities require initial and annual safety training. This training covers how to recognize errors, how to report them, and updates on best practices. One of the most effective ways to learn is through simulation and virtual reality, VR. Simulation allows us to practice high-risk scenarios in a safe environment where no one gets hurt. You get immediate feedback and can repeat a skill until it's perfect. In fact, research suggests that VR clinical training can reduce medical errors by about 40%. It's a powerful way to strengthen your competency before you ever reach the bedside. Technology is also evolving. AI is now being integrated into health records to provide allergy and drug interaction alerts, duplicate medication warnings, and even to monitor vital signs to catch a declining patient earlier. While we still need more research on long-term effectiveness, AI is becoming a helpful partner in identifying safety trends. A positive safety culture is the foundation of everything we do. It requires transparency, accountability, and open communication. We must shift from a blame culture to a system improvement culture. When people aren't afraid of being punished for honest mistakes, they report them, and when they report them, the whole system learns. We cannot talk about safety without talking about the staff. Burnout is strongly associated with increased medical errors. Organizations have a responsibility to maintain staffing and provide mental health resources, but you also have a responsibility to monitor yourself. Watch for signs of burnout, emotional exhaustion, feeling detached or depersonalized from your patients, or a decreased sense of accomplishment. If you feel these, use self-care, counseling, and peer support groups to rebuild your resilience. A healthy CNA is a safe CNA. In the surgical world, we prevent errors through standardized checklists and the timeout. Before any procedure, the team stops to confirm the correct patient, the correct procedure, and the correct site. We mark the surgical site and count every instrument before and after the surgery to ensure nothing is left behind. In diagnostics, we use interdisciplinary collaboration and performance feedback to ensure we aren't overlooking any possibilities regarding a patient's condition. Medication safety is one of the most complex areas in healthcare, so we rely on multiple layers of protection. Barcode scanning helps confirm the right patient and the right medication by matching the ID band with the drug. Tall man lettering uses a mix of uppercase and lowercase letters to distinguish look-alike medications, such as dopamine and dobutamine. With computerized order entry, providers enter prescriptions electronically, allowing the system to check for allergies and interactions in real time. And smart pumps use dose error reduction systems to help prevent medications from being delivered at unsafe levels. Most importantly, you must always follow the rights of medication administration. The right patient, right medication, right dose, right route, and right time. Always create a distraction-free zone when meds are being handled. Equipment can fail, or it can be used incorrectly. You should receive proper training on every device you use. Regularly inspect your equipment and always trace 4 lines back to their source to ensure they are connected to the right bag. We also focus on alarm safety. The Joint Commission makes this a priority. We must ensure alarms are audible and set correctly, but also work to reduce alarm fatigue by eliminating unnecessary beeping that can cause staff to tune out important alerts. 2 of the most common preventable harms are infections and falls. To prevent hospital-acquired infections, HAIs, like urinary tract or bloodstream infections, we use strict hand hygiene, proper PPE, and antibiotic stewardship. To prevent patient falls, we use tools like the Morse fall scale to assess risk. We provide non-slip socks, use bed and chair alarms, and perform intentional rounding, checking on patients regularly to see if they need to use the bathroom or need an item moved closer. Always keep the bed in the lowest position and the call light within reach. Communication failures are a leading cause of medical errors, which is why we use a structured method called SBAR. Start by clearly stating the situation, what is happening right now. Then provide the background, giving the relevant context. Next, share your assessment, describing what you observe and what you think may be wrong. Finally, offer a recommendation, explaining what you need or what action you are requesting. We also use repeatback for verbal orders in PACE, which stands for probe, alert, challenge, and escalate, when we need to raise a safety concern to a supervisor. Finally, remember, if it isn't documented, it didn't happen. Proper documentation must be factual, objective, timely, and complete. Never backdate an entry, never use unapproved abbreviations, and never chart a task before you actually do it. Last but not least, include the patient. Encourage them to ask questions and invite them to share their concerns. Patients often notice when something is different before we do. By building trust and encouraging open dialogue, we create the ultimate safety net. Thank you for your dedication to patient safety. By following these strategies, you are making a direct impact on the lives and well-being of every resident and patient in your care.